Thank you for agreeing to talk with us today. Can you tell us about the procedure that your baby had done 3 days ago?
Yes, my daughter was, I guess, diagnosed with having a lip tie and a tongue tie, pretty severe. So we were recommended to go see Dr. Margolis, who specializes in doing laser frenecotomies on both the lip tie and the tongue tie. So we went in to have an initial kind of checkup, I guess, so he could see what was going on, and then we decided to have the procedure done that day, just to kind of, two birds with one stone. So he classified it as a class 4, which is one of the worst, I guess. It's 1 through 4. She had a grade 4 on the top and the bottom. So it was a really short procedure. It was about, I think, 3 minutes on the top and about 2 to 3 minutes on the bottom. So during the procedure, I was able to hold her in my arms, just kind of up on my shoulder, and they put little glasses on her and, glasses for me as well. And then Barbara, our lactation consultant, held Nora's head, just to make sure everything was steady. And then Dr. Margolis, took the laser out and took care of it. So.
And how do you feel the baby tolerated the procedure?
The bottom went a lot better, I think, than the top. The bottom was minimal discomfort during it. The top, I could sense it was a little bit more painful for her during the procedure. We had, because she is so little, under the age of 20 or under 24 pounds, they don't give any type of medication or numbing cream or anything for her. So we were recommended to give her some Tylenol before the procedure, which we did.
And how old is your baby?
She was just 8 weeks. So she was 8 weeks when the procedure was done. So we had given her some Tylenol about 45 minutes before the procedure, which I think helped a little bit, but it still was pretty painful for her, I think.
And how soon were you able to feed her after the procedure?
So the minute it was done, they led us to a private nursing room that I was able to feed her, and she latched on right away. There was a little bit of blood, which we were told was probably going to happen, but very, very minimal. And she latched on right away, and I believe that probably helped her and just kind of comforted her and soothed her. And right away, I noticed a difference in kind of how she latched. There was less pain when she latched, so it was a better experience.
And how was the lip and tongue tie affecting breastfeeding before the procedure?
So prior to having this procedure done, I was having a lot of pain breastfeeding. It was almost like she would bite down on my nipple, and I was in a lot of pain. I was close to giving up. A friend of mine had recommended Barbara, and so Barbara was the one that noticed the lip tie right away, as well as the tongue tie. I had been told by 2 other lactation consultants that it was just a tongue tie and it was minor. The same with my pediatrician. So nobody had noticed the upper lip tie, which I think the combination of the lip tie and the tongue tie really kind of gave me a lot of pain during breastfeeding. So that's why we opted to have the laser treatment, and to have it done right away because of her age, and just with breastfeeding, and we wanted to avoid further complications later on.
And tell us about the first 24 hours after the procedure. How did the baby behave and how did she feed?
Sure. The first 24 hours, we were told that, first of all, we were told that the procedure would just be, minimal discomfort and kind of like, pushing and pulling and tugging for her. But after, I could tell it was definitely a lot more for her. She fell asleep pretty quickly after the procedure, after she had nursed. And she slept for about maybe 2 to 3 hours. But then she woke up and she was just pretty unconsolable. We were trying everything. We tried nursing. She wasn't able to latch on, and she was just really kind of hysterical with it, and we tried many things. We ended up using a little dropper to get breast milk in her mouth because her mouth was swollen on top, just because of, I think, the level of lip tie that she had. We ended up walking around outside in the neighborhood for about an hour and a half, just to try to get her to kind of calm down, and she eventually fell asleep. For the first, I would say, 24 hours, we also gave Tylenol, the infant Tylenol, to help with that, and then we also tried a wet washcloth dipped in ice water, and we let her kind of suck on that a little bit, and then also to help with the swelling.
And did you feel like the ice water and the washcloth was soothing for her?
Yeah, she definitely, she didn't suck on it a lot, but the cold helped a lot with the underneath her tongue and also on the lip. And we could see the swelling eventually went down probably in about a day.
And do you notice a difference in the pattern of the baby's sucking, like the rhythm of the sucking when she's at the breast now?
When she is feeding, she definitely, she's swallowing a lot better, and the rhythm is a little bit more natural, and she's not gagging as much. Before, she would choke. We'd have to stop her quite a bit because she would choke. And so now she's feeding, and we aren't hearing kind of the clicking, and she's not gasping and kind of coughing as much. I don't think it's happened at all. We've also noticed a decrease in the spit up after. Before she was kind of spitting up a little bit more, which I think was because of, the uneven, of the drinking. And so that's kind of changed. It's gotten a lot better.
And do you think you would do this over again? Have the procedure done for the baby?
Yes. We were so thankful to hear of Dr. Margolis, in this procedure that's done, because we wanted the laser treatment over having just snipping underneath the tongue or on the lip. And we've heard about all of the complications that can happen in the future in terms of cavities and needing braces and gaps in the teeth and just difficulties with speech. And so we wanted it done right away. And, should we have more children and this, comes up again, we would definitely do this right away, if not sooner.
Do you have any advice for other parents that are in a situation similar to yours?
Definitely, don't give up on breastfeeding. I was very close to giving up just because of the pain. It gets better, and it's doable, and, whether you decide to go see an ENT to have it kind of treated or go with a laser treatment, personal preference, but definitely recommended. It helps, I think it helps the baby out. It definitely helps the mom out, and just makes breastfeeding a lot more pleasant, and the bonding with the baby increases.